Namaste. It is so nice to be here today with you. My name is Catherine Tart. I'm the founding dean for the Andy and Barbara Gessner College of Nursing at the University of Houston. We are excited that the Indian Nursing Council has worked with those of you who are here today for the Doctor of Nursing Practice program and how you can see that program growing and evolving within your own colleges and universities for nursing and for our profession. With that, I would like to give you just a little bit of a background. Since 2018, we've had a memorandum of understanding with the Indian Nursing Council in an effort to build a Doctor of Nursing Practice program in the country of India. That has been successfully launched just recently, and we are thrilled that you are now on that journey to see how you can implement the Doctor of Nursing practice within your own colleges. So, with that, I'd like to give you just a short, brief example of what we do at the University of Houston. And I encourage you to go to uh.edu/nursing. Again, uh.edu/nursing. And on the outset, if there's anybody, faculty member, who might be interested in connecting with us, coming to the university for a semester as a visiting faculty member, that might be of interest to you as you're moving forward and growing your own programs, I want you to know that you are wholeheartedly invited to contact us and to see how we might make that something like that happen for you. So the program that we have is a postmaster's Doctor of Nursing practice. And I know that you have a nurse practitioner program for critical care. And our DNP then is designed to build upon that master's degree for the nurses who have completed the MSN. Ours is for administration or family nurse practitioner, and yours would be for critical care. It is a postmaster's program. And with that, we deliver our program in a hybrid delivery model. All of those nurses are working full time. They need to be working. The hospitals need them. The patients need them, but they want to move on with their programming. And we do a hybrid delivery model where we use both online and face to face modalities, where the students and the faculty are together weekly online, but they are also on campus. And then we also see our students in the clinical experiences. All students have to have a minimum of 1,000 hours of clinical experience. That includes what they did at the university in their master's degree and their doctorate. Adding those two together, those hours need to equal 1,000 hours. And so that means that we are at the highest level of nursing practice that we can possibly have. So, what is this like? What is this curriculum like, and what is the difference between a doctor of nursing practice and a PhD in nursing? And I think that's worth talking about a little bit here because that is a place that people get really lost and they get confused. So the research doctorate, that doctorate is looking at new data, new information. It is something that is totally different for what they are looking at within the research realm. That is what the PhD, and it requires a dissertation. So, in the doctorate of nursing practice, we are asking that the program demonstrate a student's achievement of the highest level of advanced practice registered nursing. So this is the highest level that you can go within your discipline of nursing. Much like medicine, the highest level they can go, they don't have a PhD, they have a practice doctorate in medicine. We have a practice doctorate in nursing. And so with that, we are looking at some of the successful completion for students with looking at systems information, we're looking at evidence-based care, and we are also looking at systems leadership. So how does that meet into our curriculum of these 1,000 hours of clinical system care, indirect patient care, and related experiences. So we do that within our curriculum. It's 50, excuse me, it's uh, it's about 37 to 42 semester credit hours, and we offer the program part-time because, again, students are working. So the kinds of courses that we offer are healthcare design methods and analysis. We have advanced practice, finance and economics. We have writing for publication. We have seminars. We have synthesis practicums where they are within a facility and they are learning the essential competencies for their DNP project. There's leadership and management seminars, advanced leadership practicums, complex health deviations in the care of patients in complex situations, and practicum to go along with that. There's interdisciplinary or interprofessional care seminars and focused clinical groups. There's systems management of vulnerable populations. So, what kind of vulnerable populations do we care for? Complex systems and leadership, scholarly project development, and seminars. And then, of course, they will disseminate their scholarly projects. We also offer the postmasters in education, nursing education. Um, these DNP graduates many times will become educators within our universities and colleges. And so we offer measurement and evaluation of curriculum, theories and methods of teaching and learning in nursing, and then curriculum design and development in nursing. Very important courses that we offer. And it's very important then that they have an opportunity to move forward. So, with that being said, the American Association of Colleges of Nursing came out with a report in 2022 to say, hey, what is the state of the doctorate of nursing practice? We've had the doctorate of nursing practice in the United States now, can you believe it, for 20 years. And so the report had some key findings that I would like to share with you. This is located on the American Association of Colleges of Nursing website. It is underneath their news categories, and it's called the AACN Issues New Report on Doctor of Nursing Practice Education. And so, with that, uh, students are steadily increasing their numbers in our DNP programs, and they are satisfied with their education. So I would see that in India too. More students coming into the program and hopefully being highly satisfied with their education. The increased numbers of DNP students are also identified through increasing in their differences of race and ethnicity and gender diversity. They also offer key value areas such as evidence based practice, organizational change, quality improvement, and leadership. These are the key value areas that the DNP has to offer. And then also, some of the issues that were more difficult in this review were trying to isolate the differences in the clinical skills of the MSN versus the DNP graduate. And sometimes that can be difficult for our employers to say, what is that skill set that the DNP students or graduates have in relation to the MSN, and what kind of roles are they prepared to assume? And the data currently doesn't really exist to carry out DNP outcome studies. So we don't have enough of that yet, but that will come later. Stakeholders also have suggestions on how to improve the DNP education, and the Indian Nursing Council and all of you today are able to really learn from us, including having a greater standardization in your curriculum across your universities and have rigor within the programming so that your stakeholders and your employers and your alumni can say, this is what this curriculum is about, this is how we do it, and this is the outcomes that we are looking so that we are prepared, DNP prepared nurses looking at patient outcomes and making sure that we are able to move that practice forward. And my last piece for you is please make sure you work with your practice partners. Your practice partners are invaluable. What is it that they need? What kind of patient care would be most beneficial? Talk with your physicians, talk with the healthcare providers in your facilities and in your region. What is it that's needed? And move that kind of need forward so that the DNP is meeting the needs of the populations that we are also privileged to serve. And so, with that, I thank you so much. You'll be hearing from two of our faculty, one with a PhD and one with a DNP, and you'll learn so much. And we're so happy that you all have moved forward with the Doctor of Nursing practice in the country of India, and have a wonderful conference. Many thanks.